Good evening and welcome to the COVID-19 update program on Channels Television. I'm Millicent Walker. First, the highlights. Lagos governor asks all those with symptoms of malaria to submit themselves for coronavirus tests. Kaduna State government sets up more isolation centers ahead of school reopening. And the European Commission to set up a mechanism to allow sharing of surplus COVID-19 vaccines with poorer neighboring states and Africa. And in 24 hours, 1,617 new cases of the coronavirus were recorded in Nigeria. In a late-night tweet, the NCDC, the Nigeria Center for Disease Control, also reported an additional 14 deaths, bringing total casualties from the virus to 1,449. Till date, the country has now recorded 112,004 COVID-19 infections, with over 80,000 cases successfully treated and discharged. Almost half of Monday's cases were recorded in Lagos, with 776 infections. Other states with new cases include Kaduna 147, Kwara 131, the FCT 102, Plateau recorded 78, Edo 59, Ogun 53, Osun 45, Rivers 37, Taraba 36, Nasarawa 34, 33 were recorded in Adamawa, 26 in Kano. Delta State recorded 20 cases, followed by Ebonyi 16 cases. Bayelsa recorded 11, Gombe 11, Borno recorded 2 cases. Nigeria has witnessed a surge in new cases since last December, when the federal government announced a second wave of the pandemic. Only yesterday, the chairman of the Presidential Task Force on COVID-19 said that 1 in every 5 persons tested in Nigeria within the past week turned out positive. Meanwhile, a new guidance for states has been published by the Nigeria Center for Disease Control for public and private institutions on the use of approved antigen, that's AG-based rapid diagnostic tests, RDT, for coronavirus disease. In September 2020, the World Health Organization announced the emergency use of authorization of 2 AGRDTs manufactured by SD Biosensor and Abbott for COVID-19 testing. And following this, the NCDC, in collaboration with other stakeholders, carried out a national validation of these RDTs. The validation, which was carried out during the screening held at the National Youth Service course, as NYSC camps, and it showed that the rapid diagnostic tests met the minimal standards for sensitivity and specificity of COVID-19 diagnostic tests. According to the NCDC, as more AGRDTs gain EUA from WHO, they will be considered for use in Nigeria. However, the center, the NCDC, is recommending its use primarily in congregate settings. These include settings such as schools, hospitals, for the testing of patients with symptoms of COVID-19 presenting in the hospital triage areas, and periodic testing of healthcare workers as well, and many more. Now, the Lagos State Governor, Babajide Sanwo-Olu, has asked those who feel unwell and have malaria symptoms that they should submit themselves for a COVID-19 test. The governor gave this directive during today's briefing at the Lagos House, Ikeja. He also explains that COVID-19 patients are in dire need of oxygen for survival.
In this second wave of the current pandemic, any malaria-like symptoms should be considered as a COVID-19 virus infection unless and until otherwise proven, either by doing a proper malaria test or by doing a COVID test. And so any infected individual with COVID-like symptoms should proceed to any of our public health facility and or laboratory to get tested. Last year, when after the first lockdown and kids have to come back to school, we're still looking for about 24,000 children that have not come back to school. And so there's a challenge. If you keep them out for that long, their parents or their guardians now turn them to other things. right? Instead of ensuring that they still have time to come back and have a learning, even if it's twice a week, even if it's 3 times a week, at least it's been registered. He has a class, it's the beginning of a session, right? And you can monitor them. Once some of those things are in, we just don't want to throw them because they will just be roaming and they become endangered.
The second wave of COVID-19 is necessitating the renewal safety measures at different institutions to allow daily activities continue without endangering lives. Now that some schools are reopening across the country, the National Youth Service Corps orientation camps nationwide are also following suit. Our correspondent Dari Dowu visited the Iyanapaja Lagos orientation camp and brings this report.
The National Youth Service Corps NYC has reopened camp for the 2020 Batch B Stream 2 Corps members amid concerns of the second wave of COVID-19. We are here to observe the safety protocols in place for prospective corps members who will be spending weeks at this orientation camp. Non-pharmaceutical protocols first, but that cannot be enough. No one goes into the camp without taking the COVID-19 test. We take the slightly discomforting but necessary step. Given a clean bill, we proceed to film. There are restrictions on showing the corps members on camera, but we caught up with the process of disinfecting their luggage as they wait to get tested.
Apart from the testing that's done initially, like I said, we have the IPC guys around, and so they're constantly checking, and we ask randomly in case, because it's possible that people can develop symptoms as well while on camp. So we have people on ground to make sure that we are constantly liaising with everybody on camp to make sure that there is a community responsibility.
Less than 30% of the usual capacity is mobilized to camp. They've also been scheduled in streams for ease of compliance with the COVID-19 protocol. The buzz and energy that usually radiates at the orientation camp appears to be missing. At the registration point, officials have few files to attend to. The processes have been segmented.
We wouldn't want to have an upsurge at the registration point, even right at the gate. And so they have sectioned them. Maximum we have reporting in a day here is just 200, or even less than that. And you know, all of them will not come at the same time. And this is to give room for us to have enough space to attend to them individually so that there will not be any congestion.
The NYC management believes it has tidied all loose ends with various COVID-19 interventions, and there is no cause for alarm as corps members report to different orientation camps across the country. Dari Dowu, Channels Television News.
The COVID-19 pandemic has necessitated some drastic measures to curb its spread. And while other schools resumed in several states across the country, this was postponed in Kaduna State, where the state government says it is not leaving anything to chance to contain the spread of the virus. Well, joining us for more on the situation in Kaduna is the Commissioner for Health in the state, Dr. Amina Baloni. She joins us via Zoom. We'd like to thank you for joining us on the program.
Thank you very much for having me.
Please tell us about the second wave of COVID-19 in the state. I mean, the NCDC tells us that, Kaduna State is number 6 in the list of states managing the highest number of cases. What's happening?
The world over and also in Nigeria, we are experiencing a surge in cases. We noticed the surge in cases starting from about the end of December, and we have noticed a steady rise from then on. A number of factors contributed to this. As you know, because our cases went down and we assessed the cases in the state, where at that time we were not having a lot of cases, we decided that it was okay to go ahead and start opening schools for students that needed to do exams. Apart from that, we came to the Yuletide when a lot of people were moving about, despite the appeals from PTF and various other governments. And also, we noticed at that time there were a lot of gatherings. So the state government instituted enforcement of the public health measures. Everyone that left their homes was mandated to wear a face mask in public. And the physical distancing was also enforced, as well as the ban on gatherings and the reduction of people at religious places of worship. So a number of factors culminated in seeing of the increase of the cases, and we put in the public health measures to try and stop those.
I also know that you've talked about testing and that there's also more isolation centres. You hope to perhaps build the building of a 135-bed hospital being set up to cater for infected patients. But is the state government anticipating a surge should schools reopen at this time, hence its decision that it remain shut?
As you know, there has to be a balance between what is happening and what is feasible. I know a lot of students have been out of school, a lot of them for better part of the year. And there's a lot of anxiety that children are not getting the learning outcomes that they should. But we have to balance this with public health and safety. So what Kaduna State government has done was to institute a stakeholder committee that looked at what was happening, the rising number of cases. We did some analysis to see across the LGAs, across some of the wards, where these cases were happening. We also engaged the stakeholders to understand that if there's to be a reopening of schools, there has to be a consistent enforcement and observance of public health measures. That's the only way that we can safely say we open schools and allow children to learn. So this meeting has taken place. We've come to some agreements as to what needs to be in place. And we will escalate this to the state task force, who will take the final decision on when schools should open.
All right, we hope to hear from you with the latest there on school resumption. We'd like to thank you for joining us, Commissioner for Health, Dr. Amina Baloni. Thank you again.
Thank you very much for having me.
And next to our correspondent, Hajar Aliyu, she brings us this update on the preparations by the Bauchi State government to receive the COVID-19 vaccines expected for healthcare workers by the month's end.
The Bauchi State government says it is fully ready to receive the COVID-19 vaccine. The state government has just purchased 2 ultra-low temperature freezers in anticipation of the vaccine at the end of January this year. These freezers were purchased at the cost of 21 million naira. And the state government said there are already 4 standby generators in case of power outage. So power supply won't be a problem to store these vaccines in the required temperature. Earlier, I spoke to the executive chairman of the Primary Healthcare Development Agency, Dr. Rilwanu, and this is what he had to tell us about this newly acquired freezers.
His Excellency, the Executive Governor, already bought 2 of these machines, minus 86 degrees centigrade. And they are here working already. We installed them. And they can contain up to 678 liters, the 2 of them, 678 liters each. And we are only expected to get 1,900 doses of Pfizer vaccine, which is coming in at the end of January. And so we wrote a letters and informed MPSCDA, ED executive that we bought these machines. We are waiting for them to actually give us the vaccine. We are ready to receive any vaccine. That is the first batch meant for healthcare workers. We will procure the 2 stabilizers, and then we have to connect it so that there will be no jumping of light. When there is problem of fluctuation of light, it affects the storage of the vaccines. So we brought some people from the company that supplied this ultra low freezers to come and install it here.
There are already misconceptions about the COVID-19 vaccines even before they arrive the state. What this means is that the state government needs to carry out more sensitization before the vaccine arrives the states. From Bauchi State Central Cold Room, Hajara Aliyu for COVID-19 updates.
Still ahead, more on the global measures to curb the coronavirus. That's in a moment. And we continue in the United Kingdom with, of course, the restrictions in place till March, talking about England now. Prime Minister Boris Johnson says that over 4 million people have received the vaccine. We understand that more vaccines are being expected. More vaccination centres are opening up 24 hours. Sadly, nearly 1,000 people are dying each day on average. Other countries like New Zealand, for example, has not recorded a single death since September. And we have a University of Oxford researcher saying that some of those countries took quicker and more decisive actions in the early stages of the pandemic. Well, joining us from Birmingham right now in the United Kingdom is Dr. Essien Ukarebi. He's General Practice Specialty Registrar, Worcester Royal Hospital. Good to see you. Thank you for joining us on the program.
Thank you very much, Millicent.
All right. First, are you optimistic that the lockdown till March was the best decision by the government?
Well, what we've currently seen with the second wave of the COVID-19 virus in the United Kingdom, I think that the lockdown was the best decision that could have been taken at this point. Like you rightly said, an average of about 935 persons die daily in the United Kingdom. And these are shocking numbers, to say the least. So I think putting the lockdown in place is actually the right thing to do by the government.
How are people taking it? I mean, we're hearing about studies in Japan, how suicide rates have jumped in the second wave. And that's because, I mean, there are perhaps not a lot of palliatives unlike the first wave, but that's Japan. But how do you think people are taking this lockdown in the UK?
Well, in the UK, it's a little bit different. So the UK, sometime last year, during the first wave of the coronavirus, started what they called the furlough scheme, where persons who were made to stay at home were paid 80% of their normal salaries. And the government, during this second lockdown, have extended the furlough scheme so to cover 80% of people's salaries, people who are made to self-isolate or people who are made to stay home as a result of, you know, the lockdown and the restrictions. So people are taking it well, optimistically, I would say, because on one hand, the government has been able to pay part of their salaries. And on the other hand, there is hope with the prospects of the vaccine. So like you also said, 4.2 million persons in the United Kingdom have now received their vaccines. So that's something to smile about, you know, in the United Kingdom at this point.
And indeed, you mentioned it, the vaccine. You have received the vaccine. How do you feel?
Well, I received my vaccine yesterday, and few hours afterwards, like we have read and we all know, with the vaccine, just like every other vaccines, you can have some side effects. So like muscle aches, increase in temperature, not feeling too well. And I had a couple of those symptoms towards yesterday night and also this morning. Was not strong enough to go to work. But as the day progressed, I got better and I'm fine speaking to you here today. So I'm happy I've had the vaccine. This would help me, you know, reduce the risk of transferring COVID to the next person and also help me, you know, from developing symptoms of COVID. So at this moment, I feel well and fine after taking my first shot of the COVID vaccine.
All right. Well, when do you get to take the next one? And would you say, I mean, what would you say to people who are still skeptical about taking the vaccine?
Well, I get to take the next vaccine. Usually you take it after 12 weeks. So my next shot will be sometime in April. And to people who are still skeptical, I would say that we can see from the statistics every day, about 3.5 4 million persons have got COVID in the UK, and about 91,000 have died so far, unfortunately, in the United Kingdom. And the vaccine offers some hope. So I think if you're wise enough, you would go for the vaccine. Lots of Black people have been taking the vaccine and they've been absolutely fine with the vaccine. So I would advise anyone, if you have an opportunity to take the vaccine, take the vaccine. The vaccine has been shown to be safe and it can reduce your chances of getting COVID by over 95%. So I would advise anyone contemplating that it is the right decision to make. There are many speculations and many misinformations about the COVID vaccine. And I want to say that it's quite unfortunate that we have this misinformation going around, but the vaccine is safe. It has been tested. It has been tried, just like the many other vaccines that we have around. So go ahead and take the vaccine, protect yourself and the community.
I also know you mentioned that you took the Pfizer vaccine. I want to ask about countries like Nigeria. Do you think it's the best for us in terms of cost, in terms of storage and, accessibility?
Well, the Pfizer vaccine, in terms of storage, seems to be a little bit not very suitable. So it needs to be stored in a temperature of minus 70 degrees, if I'm correct. And other vaccines can be stored at normal fridge temperature. So if Nigeria must get some of these vaccines, then they have to invest in buying machines and refrigerators that can go as low as minus 70 degrees to be able to preserve this vaccine and preserve the efficacy of this vaccine. In terms of the cost, I might not be able to speak particularly on the cost because in the UK, the NHS covers the cost of the vaccines. But I would say the storage is a key point for Nigeria to look at if they must get this vaccine so that we don't have vaccines that go into waste.
So I just wanted to ask you one very quick question, and if you can answer as brief as you can. So do you just walk around now, the UK, like you're invincible since you've taken the vaccine?
Well, I mean, whether or not that you've taken the vaccine, it's still important for you to put on your face mask. It's still important for you to maintain hygiene, hand washing and things like that. Because the vaccine, what it does is that it prevents you from developing symptoms of COVID. So it prevents you from getting COVID, but that doesn't stop you from transmitting the virus, from one person to another by, touching someone who's been infected and moving on to the next person. So we still wear the face mask. We still wash our hands. We're not invisible. We need a large population of people to get these vaccines and to be immunized before we can get to that stage where people can walk around freely.
All right, Dr. Essen, always a pleasure. Thank you so much. Dr. Essen Ukurabi, General Practice Specialty, Registrar, Worcester Royal Hospital. Thank you for joining us on the program.
Thank you so much, Millicent.
Let's check in further on developments surrounding the coronavirus pandemic. Now, even though schools have reopened in Nigeria despite concerns over the second wave, in the UK, however, those concerns are being put aside as the government says it wants them to reopen as soon as possible, which is only dependent on a number of things, including the progress of the vaccination program, the possibility of the new coronavirus variants, and the emerging trends about people resisting the jabs. Take a look.
President, honorable members.
The European Commission wants to set up a mechanism that would allow the sharing of surplus COVID-19 vaccines with poorer neighboring states in Africa.
Through the vaccine sharing mechanism, we will help priority groups in the Western Balkans and neighbourhood countries, as well as health professionals in low-income countries, particularly in Africa, and most vulnerable populations in humanitarian settings to get early access to vaccines.
The EU, with a population of 450 million, has already secured nearly 2.3 billion COVID-19 vaccines and candidates from 6 companies, although most of them still need regulatory approval. South African scientists say previous infection with the coronavirus may offer less protection against the new variant first identified in South Africa, although they hope that vaccines will still work.
Our immune systems are extraordinarily clever. So although there may be small changes in the virus, and therefore the antibodies may not be binding as well. There may be compensation through other arms of the immune system that allow the vaccines to still work.
Studies also found that the new variant binds more strongly and readily to human cells, and according to South African epidemiologist, that explains why it seems to be spreading around 50% quicker than previous versions. In China, a sports stadium at the outskirts of Shanghai has been converted into a COVID-19 vaccination site as the country seeks to ramp up inoculations amid a new upsurge in infections. China has been battling the worst outbreak of COVID-19 since March 2020, with one province posting a record daily rise in cases. This comes as an independent panel reviewing the global pandemic says China could have done more to curb the initial outbreak.
Let's continue to take responsibility. You can visit our website. It's channelstv.com. It has more updates, a better understanding of the pandemic as it's happening here in Nigeria and across the world. You'll also find some other stories, news on politics, business, and sports. That's the COVID-19 update. Thank you for watching. I'm Millicent Walker. Stay safe.